my name is Catherine Norwa, and today we are going to talk on the topic of high blood pressure. And high blood pressure is also really known as the silent killer because it can come with no symptoms and it just hits you and can lead to stroke. Otherwise, we're just going to make the topic short so that you can at least have an idea of what blood pressure is, what precautions to take, the risk factors, and the treatment. So, do you know anything about blood pressure? Jean, have you ever heard of anything about blood pressure?
Nah, I've heard it's a bad thing to have high blood pressure. I've never had high blood pressure myself. I think I'm pretty sure the doctor never told me I had high blood pressure, but I've heard that it's not a good thing. But it has to do with like the pressure, right, in the veins or something.
Yes. Yeah, so blood pressure literally means blood pressure is determined by both the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher the blood pressure. Which means, this blood is going through some pressure. Because usually in a normal artery vein, the blood flow is smooth. But because of damage to those blood vessels or arteries due to disease, the blood cannot just flow, freely. So it causes some pressure, and that pressure will lead to it will raise the blood, raise the pressure to those arteries and hence the blood pressure. So one can, like I said before, one can have blood pressure without any symptoms. Damage to the blood vessels can continue undetected. Uncontrolled blood pressure can lead to heart attack or even stroke. So that's why they say it's a silent killer. Some people have no signs at all or any symptom. And, like you've heard of this guy, Luke Perry. Maybe he had I'm just saying, maybe, because it was just so sudden. So you just never know.
Right, that's the guy from
90210,
yeah.
Oh yeah.
Yeah, so
he died?
No,
Oh.
he hasn't died.
Okay.
No, he had a stroke.
He's just had a stroke. He's
Oh.
still in hospital, so we just pray that he'll be fine. So like we say, some people have no symptoms while others will have headaches, shortness of breath, and even nosebleeds. And especially some people, their nosebleeds are associated with headaches. So that can also be a sign. And then blood pressure should be checked on both sides to determine if there's any difference between the two. It is important to use appropriate side. So some doctors like to test both arms, and sometimes there's a difference, sometimes there's not, depending on the degree of the blood pressure the patient has. So the causes of blood pressure. So the causes in most adults is unknown, so which is also known as primary or essential hypertension. You just have it, you have no risk factors, you're not obese, you just got it. And then secondary, this is the one where most people have. They have usually an underlying condition, especially like if you have any kidney issues, any these are tumors in the adrenal glands in the brain. Then there's also the thyroid conditions, and also there's some medications such as birth control pills, cold remedies. Can you imagine the cold remedies we take every day? Decongestants and over the counter pain relievers also can cause blood pressure. And then also illegal drugs such as cocaine and amphetamines, because all these will have some damage to the arteries and veins that will lead to high blood pressure. So they say that the risk factors here, especially for women, they say you are more likely to develop high blood pressure after 65 years, but men earlier than that, which is earlier than 64 years. The common, the race, the more the African American heritage have the most high blood pressure. And then family history. So there's some families that everybody has high blood pressure, or your father may have it, your mother may have it, the children may have it, or just somebody along the lineage will develop the blood pressure because one of the parents or both parents had it. And then overweight and obese, they say that the more overweight we are, the more at risk we are, because when you are obese, the heart has to pump harder. So because of that, it causes pressure to those arteries and then to lead to high blood pressure. And then not being physically active. They say that people who are inactive tend to have higher heart rate. Their heart beat faster. But just like I said, when it does that, the higher the heart rate, the harder the heart has to work. And so for each contraction and each, the way the heart beats, it causes a lot of force in those arteries, and hence it will lead to high blood pressure. And also they say that lack of physical activity also increases the risk of being overweight.
So what? So how much should someone exercise? Like, should they like an hour a day type of thing, like they usually say, or?
Yeah, at least not just an hour a day, but because we all have different times we work. At least even if it's not every day, but at least 3 times a week, that still is good because you're doing something to your heart. You're making it stronger, and it makes the heart. Heart rate, for those who are athletes, their heart rates are much slower, but stronger.
Well, when you said it, I thought to myself, I'm like, well, I wouldn't have expected that the less active you are, the faster your heart is beating. But when you're working out, it feels like your heart is beating faster.
It will beat faster for that time you're running and doing it. But then
it makes sense,
then it will stop. It will stop that. It has that.
Because it's not fit like any other muscle.
Yes,
it needs to work harder to get as much done as like another.
Exactly. So you need to do that. And then tobacco use. People who chemicals used in tobacco have damaged the lining of the arteries. It makes those walls hard, and you've heard that when those walls become hard, the blood flow in there has to really struggle, so that it will increase that. So it's a risk factor. And even secondhand smoke, you may not be smoking, but people smoking around you, you get that. And I've seen people who've gotten even lung cancer from secondhand smoke. They've never smoked in their lives, but because they lived with people who smoked. Yeah. And then salt in the diet. Too much salt also is not good, because salt tends to make you retain fluid, and when you retain fluid, the heart has to beat faster, or beat more, has to really, increase, like they say, may cause the body to retain fluid, which in turn increases blood pressure. And then potassium in the diet. Potassium helps with balancing sodium in the cells. So you had sodium up here, makes you retain fluid, which is not good. And then if you do not have one does not have enough potassium, one may accumulate too much sodium in the blood. So sodium and potassium, they have to balance each other, because also too much potassium is really bad to the heart, and too much sodium is also bad to the kidneys and the heart, because you retain a lot of fluid. So they just were made to balance each other. And then drinking too much alcohol. So over a period, heavy drinking can damage the heart. Having 1 drink a day for women and 2 drinks a day for men may affect the blood pressure. But they just say drinking in moderation is recommended. And then they also say
I've always heard that with the
Yeah,
what?
yeah,
The
I've
drink?
heard that
yeah,
too,
with the
yeah,
drinking,
with the
it's
drinking.
it's like the pregnant women. Don't drink, but if you have a glass of wine, it's
No,
fine.
just like that one
Just-
glass of wine.
Yeah, just in moderation.
Moderation,
Don't
yeah.
go- Don't go beyond that. And then chronic conditions. We had talked like for conditions like kidney disease, diabetes may also increase the risk of blood pressure, because whenever you have diabetes, you also have high blood pressure, you also have cholesterol. You know, it's just one thing after the other, and all these are really at risk for you getting the high blood pressure.
So if you have diabetes, you're gonna have high blood
blood-
pressure.
Most
but
of the time.
If you have
yes.
high blood pressure, that doesn't necessarily mean you're gonna get diabetes, right?
Yeah, but they have that ripple effect.
Yeah,
Because
one
it
and
might
If you
come
know, like,
at some
after,
point.
yeah.
They have that ripple effect, because these organs, the kidneys, the heart, they complement each other. So that even if the kidneys are affected, believe you me, even at one point the heart will also be affected.
Yeah.
So they complement
Like a
each
car,
other.
everything
They-
has to work or
to
sooner
work.
or later. Yeah.
Exactly, in sync,
Yeah.
or in sync, yes, in sync. So some
So-
of the complications that we learn about are like excessive pressure on the artery walls, caused by the blood pressure can damage the blood vessels. There could be a heart attack or stroke. So high blood pressure causes the thickening and hardening of the arteries, which can lead to heart attack or stroke. Aneurysm. High blood pressure can cause blood pressure vessels to weaken or bulge, forming an aneurysm. If the bulge ruptures, it can be life-threatening. This is like on the vein. Because of the constant pressure, that part of the vein is weakened, and then it bulges. And sometimes that's when, like, you see people with stroke, the blood vessel will bulge, and
You can see it, right?
yeah, on the MRIs and scan. That's why everybody who has a stroke, they have
Can you
to.
get on blood clots through that too?
Yes, even that one can happen. Yeah,
Okay.
because the blood clot did not get through, or
Yeah.
it's stuck somewhere, so there's no blood
A blood
supply
clot would
to that.
create high blood pressure too, right? Because it can't.
Yeah,
if
it
it's
is.
causing.
Yeah,
a
it's causing,
blockage.
especially like especially in the brain, the higher centers, it will cause also issues with that. And you find that, so when this and the blood vessel weakens and bulges and breaks, so that's when it causes hemorrhage in the brain, and that's when that's the one they call hemorrhagic stroke, and that one is really detrimental. It's just grave situation. So we have
Bleeding
to,
in your brain.
Oh,
it's
dangerous.
it's the one that leads to bleeding in the brain. Then heart failure. The heart has to work harder to pump blood against the higher pressure on the arteries. This causes the left side of the heart to thicken. The thickened wall will eventually not be able to pump blood to meet the body's need, which will lead to heart failure. So you find that some people just have that heart failure there because that heart cannot meet the demands. It's already a weakened heart, and especially when one side of the heart is, like they say,
Weakened.
is thickened, it can't beat that, the way it's supposed to be. Sluggish, and this will lead to, eventually heart failure.
So
And-
that is that because one side is working harder than the other side.
Yeah, because usually one side of the heart, the way the heart is divided, one side is much thicker or strong. I mean,
Is it the side that takes in the
the
dirty blood?
oxygenated, the
Okay,
oxygenated blood, yes. So when that happens, then when the heart is weakened because those blood vessels cannot pump properly, then it will lead to the whole heart failure thing. And then weakened or narrowed blood vessels, like we had said, this can prevent the kidneys from functioning, because the kidneys also help to remove the waste products, the water and all that. So if the blood vessels are not working, then the kidneys also will not be able to do its job. And then it also goes to the eyes, that when the thickened, narrowed, torn blood vessels in the eye, this can also lead to vision loss. So our arteries are very, very important. Then metabolic disorders. This means that most of the like the bodies, this cluster of disorders of the body is leading to high cholesterol, diabetes, heart disease or stroke. These are like disorders which come because the kidney is not functioning well. It has something to do with the metabolism of the metabolism in the body. So it will also lead to all that. And then trouble with memory and understanding. They also think that, you know, when you have high blood pressure, because there's also not that enough oxygenation to the brain, so you can't function well, and you can't even think, remember, or even learn. And then I think they've also now linked it even to dementia, you know, where these people cannot even know, you know, they find that when you have dementia, your mind is completely, you are not even able to discern who your children are. You don't know, you know, you can walk out of this house and not even know where you're going. That's how bad dementia is. Yeah. And then treatment. So treatment actually needs to start with life changes, especially if you remember those at risk that we have talked about, the alcohols, the
Exercise.
exercise and all that.
Not assault.
We need
No
those,
salt.
yes, we need those life changes.
Okay.
So eating a healthy diet, low salt diet, you know, don't like I usually tell these children, don't add salt, just eat what's in the food. You know, people just become so used to just,
Adding
you know,
salt.
it's just automatic. You don't even think about it, but you just need to just eat the what the food has. Then getting regular physical activity. You may not go every day, but even 3 times a day, or just a run around the block. You people are still young, you can do that. And then maintaining a healthy weight or losing weight if one is obese. And then limiting amount of alcohol. Then practice relaxation, slow breathing exercises, just to manage the stress, because you had stress can also be one of those risk factors. And then monitor blood pressure at home, and don't smoke if you.
So if let's say I go to the doctor today, right, and the
Yeah.
doctor tells me I can have high blood pressure today,
Yeah.
I can do all these things and reverse that. Is it like once you get high blood pressure, can you do things to not have high blood pressure?
Exactly. So that's what we have.
Dying.
So that's what we have said here. Life changes is very important, because if you are not doing any exercise, it would be nice to start. If you are obese, it would really be nice to start looking at weight reduction strategies. And if depending on how severe the high blood pressure is, the doctor may also start you on medication. And it would be nice also to have, if you can have your own blood pressure machines. These days you can buy them over the counter at CVS, and then take your blood pressure. And of course you have to know your readings.
I was gonna say,
Yeah.
Yeah.
Because
Not
they
the
always say,
normal.
oh, that's normal, okay, if
No.
you say so.
That's real. Okay, yeah, it's nice to know what the normal is when the doctor tells you your blood pressure is reading 120/80. That's a good reading. But if the doctor tells you your blood pressure is 160/90, that's not good.
Okay.
So you need to start looking at your
Exercise,
life.
calm down on your
Yeah,
diet.
and it's not just one thing, it's a combination.
Yeah.
Like
Usually,
you know, you'll do the exercise, you'll eat a proper diet, and then also
Plus, the
you
time
follow
that
up.
you rest.
Hmm?
Time that you rest too, right?
To
Just-
rest.
Yeah, you get some rest time.
Yeah, rest time is also important, but
He's
also
telling us to exercise. He's thinking about resting.
yeah, you do the exercise and then but you also rest. And also if you have the high blood pressure, like for example, if the doctor says your blood pressure is 160 over 90, you need to follow up. Okay? With blood pressure, because you remember we said it's a silent killer. However marvelous, wonderful you feel, you still need to follow up with your PCP, your doctor. Okay? Yeah, because like we have said before, blood pressure, some people have no signs, no symptoms at all. In fact, even yesterday, one lady told me, can you take my blood pressure? I'm really having a headache. And sure enough, when I did take her blood pressure, it was 170 over 90.
Wow.
I told her, you just need to go and see your doctor now, you know. So, but she was at work. She was working, but she just felt this headache. But she does have high blood pressure. But she just felt something different. So, you can see how high it was.
So if you go through like a traumatic experience and
Yes.
then you go to the doctors and they're like, oh, you have high blood pressure, could it be just from like the stress of what you just went through, or could it be just
Yeah, so it could be like the stress, because we said stress is a risk factor. So if you did not have high blood pressure initially in your life, you've never had blood pressure, he'll maybe write for you, recommend some medication that will maybe calm you down because of that stress situation that you have. But at least follow up, and maybe, because if it's just the stress situation, it might just
It'll go away.
it
on
might
its
just
own.
go away. Yeah. But
because you want to just follow up?
but you just want to follow up.
Yeah, because I'd imagine in a moment that you're like, you know, like if you're panicked or something, in
Yeah.
a moment of, you know, that you got adrenaline rushing, I'm sure your blood pressure gets higher. But
Exactly, yeah,
Yeah.
it does, yeah. So it would be good to, if you were at you had gone to the doctor because of some event, you just need to be seen and he'll treat you for that, but follow up just in case it was just because of that
just to
event.
make sure, yeah.
Yeah. And then diuretics. These are not water oils, it should be water pills. They're also called water pills, just to get rid of that excess water from your body, to reduce the sodium. You remember we said when sodium is a lot in your body, so it will do that. And it will reduce the sodium and water in your body.
So men are more, right? You said men are more prone to get high blood pressure than women, right? Or we get it earlier.
Yeah, you
right?
get it earlier.
Is
yeah.
that one of the reasons, right? Because men hold water more, right, than women for the most part. Or?
I don't think so. It's just like the way some diseases are more common to women than men, or others are more
Okay.
common to men than women. So in this particular one, men tend to get it.
That's why women live long.
Exactly. That's true. That is true. That is so true. So these are just a few of the medications I wrote here. Just, you know, the names are like this: angiotensin converting enzymes. We call them ACE inhibitors. These ones just relax the blood vessel, because you remember I told you that because these blood vessels are damaged, so these medications will relax the blood vessels so that blood can travel smoothly. And then calcium channel blockers, these are the same but just different names. They also relax the blood vessels and also slow down the rate, because sometimes when the heart tends to beat faster because now of due to the damage down to those
The vessels,
arteries.
yeah.
Yeah. So the heart has to really try to pump fast to circulate blood through the body, and that's a real stress to the heart.
It's like when you try to bend a hose, right, type of thing. When you try to like bend
Yeah.
it a little bit, and it makes it harder for the
Yes,
Water to
exactly.
go through.
Water to get through. Yeah, that's a good example. So sometimes people go for alternative medicine. So especially now, these are just like the food, fiber, wheat bran is good, they say. Minerals like magnesium or calcium, potassiums are good. Other supplements like CoQ10 or cocoa are also good. And then omega-3 fish oil, they say, is also good for treating the blood pressure. And then, of course, when you're out there, you need a support system and how to cope. So we are told that you have to take your medicines. Like, if the doctor says 2 pills, please don't give yourself 1 pill. Take 2, and then you schedule the doctor's appointments regularly, without fail. Even if you took it that day and you said, oh, it's 120/70, I don't need to go. No, you still need to go. And then, like we had said previously, adopt healthy habits and try to manage stress. Yeah, I know. Like we said, stress.
Yeah.
Stress is something that we can have. We didn't even know it would cause blood pressure, but it really does. And so that's the end of our.
It's for those carefree people. They don't get high blood pressure.
Right?
They say, I don't care. Oh, the bill, it's overdue. I don't care.
That's true, but maybe inwardly
They're dying.
they're dying.
Blood pressure.
you know?
Blood pressure is
Yes,
high.
yeah. So if you have any question or any comments,
Well, for me, it's just the thing that stuck out is diabetes. Once you get diabetes, you can't take it away, right?
yes.
But high blood pressure, you can. So the biggest thing for me that I took out is like, well, make sure you try to keep yourself from getting high blood pressure, so you don't end up getting diabetes too, or
And,
something like
no,
that.
and even with that diabetes, it may not go away, but you can keep it under control.
Under control.
Yes, because some of these diseases, people have lived with them. I've seen in the hospital people who've had diseases from diabetes from the time they were teenagers, and now they're in their 80s and still going strong. So you just have to keep it under control.
Yeah.
Yeah, it's something you live with, but you just have to be ahead of it.
Yeah.
Because diabetes is also one of those diseases that it's up to you, because you have to eat a regular diet. Of course, now your diet will change because you are not going to eat all those carbohydrates that you used to love or you love. Everything has to be to a certain degree, a certain portion of your food, of your medication, and you'll be fine.
You have to plan more.
You saw it, even we have some athletes who are diabetics, but they are running, they are swimming, jumping. Yeah, so just because you have it, it doesn't mean you just have to stay ahead of it.
Just be responsible.
That's the thing.
So it's not hereditary, right?
What, diabetes?
Yeah.
No, diabetes
Right.
is
Yeah.
hereditary.
So if it runs in your family, like my uncle
Yes.
has it, I know my grandma had it. So
Yeah.
so I should make sure that I
Yeah,
go
my dad had it, so I
check.
always
Yeah,
Yeah,
my
so what-
uncle's going through it right now.
Yeah,
too.
so it runs in families and it catches with, like somebody said that it skips a generation. Like maybe your parents had
like
it.
baldness.
You may not have it, but your children will have it.
Okay.
It might skip a generation like that.
Yep.
Or sometimes even, the siblings might have it. But sometimes it does. So you just can
Yeah,
never know.
Yeah,
Mm.
not my grandma, but my grandma's mom had it, and then my uncle has it. Right, like he's going through it right now,
Yeah.
and now
But none of you siblings have
no,
it.
none of my siblings have it.
Okay.
So you should just
So
regular
just
Exercise.
say,
checkups.
Yeah.
Regular checkups. Just make sure we're good.
yeah, so just to make sure you're good, your lifestyle and your whatever you eat, and just do the right thing.
Yes. Yes.
Okay, so thank you very much for coming. I'm really grateful.
Thank you, that was really
Thank you. That was a
Definitely,
great
yeah.
presentation. Yeah.
Thank you. Thank you.